Hi, welcome back to my plastic surgery notes. Today we are going to take a look at the classification of scars. Well, scars can be classified based on appearance into mature scar, immature scar, and unstable scar. So, a mature scar is a flat, soft, and supple scar that almost matches the surrounding color. An immature scar is red, slightly elevated scar that could be itchy and painful. An unstable scar is a scar over bony prominences, thin subcutaneous tissue, or over the joint, which is subjected to repeated trauma and easily breaks down. Then, pathologic classification is into atrophic scar, hypertrophic scar, and keloid. An atrophic scar is one which is depressed. Okay, before that, what we mean by pathologic scar? It is an abnormal scar due to excessive or deficient collagen production. So an atrophic scar is a depressed scar below the skin surface level due to collagen deficiency. An atrophic scar can be ice pick scar, box scar, a shallow atrophic scar, or a valley scar. An ice pick scar is usually a small scar with wide edges that taper down to a single point. A box scar is a scar that is oval or circular in shape, slightly depressed, and has vertical edges with a flat base. A shallow atrophic scar is a scar that usually occurs in clusters of several box scars over the cheek area. Valley scar is usually deeper scar with an undulating appearance due to variable loss of the dermis. Then next is the hypertrophic scar. It is a red, itchy, painful, and raised scar within the confines of the original injury. It can be subclassified as a linear hypertrophic scar or a widespread hypertrophic scar. Hypertrophic scars usually appears at approximately 6 weeks following wounding and progresses for a few months, like 3 to 6 months, before it becomes static and begins to regress. Together with the keloid scar, it can be grouped as fibroproliferative scar. A linear hypertrophic scar is a scar that usually follows a linear surgical incision wound or a traumatic wound. A widespread hypertrophic scar often develops after a deep burn injury. Then keloid. So the pathology classification was atrophic, hypertrophic, and keloid. A keloid is a scar that is raised red to purplish in color and usually itchy and painful that extends well beyond the margin of the original wound. This scar often develops up to 1 year after wounding, does not regress spontaneously, and is highly prone to recurrence following simple excision. Based on the trauma inflicted, scars can be divided or classified into surgical scars and non-surgical scars. Surgical scars are those scars which are due to surgical incision. These are mainly clean, not usually contaminated, and can be approximated for healing by the primary intention. Non-surgical scars are scars that occur due to a traumatic wound such as laceration, abrasion, burn, gunshot, bite, crush wound, infection, etc. So to revise it again, classification of scars is based on appearance into mature, immature, and unstable scar. Then based on the pathologic factor, it is classified into atrophic, hypertrophic, and keloid. Atrophic has different types: ice pick scar, box scar, shallow atrophic scar, and valley scar. Hypertrophic scar can be linear or widespread. And then we have keloid. And then based on the trauma inflicted, it can be a surgical scar or a non-surgical scar. Thanks a lot for watching. See you in the next one.